And our final speaker will be Beverly R. Charles, who currently serves as the Senior Citizen Liaison for Representative Marsha Fudge of the 11th Congressional District. Beverly's position includes assisting the aging population navigating through the many problems, complicated systems of our government. She served in the same capacity in the office of the late Congresswoman Stephanie Tubbs Jones. She also served as a supervisor of the pretrial diversion program at the Cuyahoga County Prosecutor's Office, evaluating the eligibility of first-time felons charged with nonviolent crimes. Both former positions were under the leadership of Stephanie Tubbs Jones, her childhood friend. Beverly grew up in Glenville, and early in life learned the importance of giving back to her community through involvement with VISTA and as a candy striper at Forest City Hospital. She was recently featured discussing her passion for seniors issues in Voice of the Village, a publication of the Eliza Bryant Village. Beverly's own personal commitment to community includes board positions with Golden Age Centers, Senior Outreach Services, Neighborhood Centers Association, and the Catherine R. Tyler Neighborhood Center. She serves on advisory councils for Cuyahoga County Adult Senior Services, Cleveland Municipal Drug Court, Cleveland Police Foundation, the Alzheimer's Association, Senior Voice, and Eliza Bryant Village. She also serves as representatives, Congresswoman Fudge's designee on the African American Museum of Wilberforce. She is a member of Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority and a lifelong member of East Mount Zion Baptist Church. She resides in Euclid but has close ties to the Glenville area. She went to Ohio State University and is still active with their Alumni Association. Beverly has dedicated her life to service and the empowerment of her community. Her humanitarianism has won her honors and acknowledgments over the years. Most recent honors is the Nguzo Saba Award, which honors a person who represents the 7 principles of Kwanzaa. She credits one of her most valued treasures as the bountiful smile received from someone she has helped. I am also on the Cleveland office of the Commission of Minority Health, along with Beverly Charles.
And lastly, engage in civic discussion. We have a wonderful, wonderful resource here from Representative Fudge's group, and she's here and she wants to listen to your stories. She wants to know what you're going through, so she could go and tell Representative Fudge when she goes to her meeting how important this disease is for you, for the African American community, for our Metro Health community, for Cleveland community. So without further ado, I want to introduce a wonderful, wonderful person who has just been instrumental in just being your advocate to the representative.
Thank you, Dr. Choi, and good afternoon. How is everyone today? Now, I am so happy to be here today, and I have the pleasure of thanking Glenda and her advocacy group for inviting me. Gives me an opportunity to tell you what the federal government is doing, and also to hear what you have to say, so I can take this back to my boss, who is Congresswoman Marsha L. Fudge, and she can relate to her colleagues in Congress how important it is for advocacy. And that's what I have to thank Glenda for, and thank all of you for your advocacy. Because without your advocacy, people in Congress, they would just go about their own merry way and not think about how important health disparities are, certain diseases that just don't get the information, that people don't get the information that they need to get. And that goes back again to what Dr. Choi had mentioned and what all of our panelists have talked about in having access, accessibility to care, advocacy, education, and awareness. Because if you're not aware, then you just don't know. It's not a fault of anyone, but being able to have the ability to have access to quality and good health care, not only for sickle cell, but for all the diseases that are out here that just does not get the attention that we should give it. So I am here to hear your stories, but I just want to let you know that how important sickle cell has become on the Hill in D.C. When our President Barack Obama, decides he is going to make a commitment to funding research and giving dollars where they are needed to try to get cures or try to make our lives better while we are here on earth, and to have good quality health care. So when he speaks, his departments take notice. Therefore, Kathleen Sebelius, who is the head of the Department of Health and Human Services, has decided to make sickle cell her primary focus. Now, does that mean, oh, everything is going to change automatically, everything, is going to change the next month or even the next year? Not necessarily. But it is a focus, and she's going to work hard in a collaborative effort to try to persuade members of Congress to fund the different projects, to fund the research that is so greatly needed. So I'm probably preaching to the choir when I say, there is an estimated 72,000 Americans who live with sickle cell disease in the United States, and approximately 2 million Americans, including 1 in 12 African Americans, who carry the sickle cell trait. While advances in healthcare have certainly increased life expectancy for individuals with sickle cell disease, much more needs to be done to expand access and improve healthcare and outcomes. Better coordination and collaboration across health and human service agencies can significantly improve the care of people with sickle cell disease through enhanced disease surveillance, reliable access to quality care again, and services, innovative new drug development, and biomedical and behavioral research. Therefore, Secretary Sebelius has charged HHS, which is Health and Human Services, with making sickle cell disease a priority area of focus. The following operating and staff divisions have come together to develop what they call the HHS SCD initiative. And those agencies are the Agency for Healthcare Research and Quality, Centers for Disease Control and Prevention, Centers for Medicare and Medicaid Services, which is CMS, the Food and Drug Administration, Health Resources and Services Administration, the National Institutes of Health, Office of Minority Health. And to speak of Offices of Minority Health, we have in our audience from the Cleveland Office of Minority Health, Ms. Ivanka Hall. And Ivanka, would you just stand up for a moment, please? I saw her out the corner of my eye. And Ivanka does so much in her capacity of bringing healthcare issues that we may not be aware of to the public. And that's a big effort. That's a large effort. So Ivanka, I thank you for your services. These are some of the initiatives that HHS indicates are needed to help improve the health care of people with sickle cell disease. Improve the care of adults and children with sickle cell disease through development and dissemination of evidence-based guidelines, Identify measures of quality of care for individuals with sickle cell disease and incorporate them into quality programs at HHS. Increase the availability of medical homes to improve access to quality routine care, including specialty care. Provide state Medicaid officials, healthcare providers and patients, and advocacy groups with information about federal matching funds for education and services related to the care and treatment of sickle cell disease. Create a comprehensive database of individuals with sickle cell disease to facilitate surveillance and the conduct of clinical research. Work with the pharmaceutical industry to increase the pipeline of effective treatments for patients with sickle cell disease. Support research to improve health care for people with sickle cell disease, including pain and disease management, and to understand the clinical implications for individuals with sickle cell trait. And last, to convene a roundtable to engage national sickle cell advocacy and expert organizations. Now, that's a huge agenda. I agree. And what we need? Funding. Without funding, none of these things will happen. So it goes back to you again and your advocacy, because the more you call up your congressperson, not mine, because I tell you, she supports everything that you do. But honestly, the more you hamper in, and talk about what we need, what we want, what is fair and equitable, they do listen. They do listen. It may not happen overnight. It may not happen next month. It may not happen next year. But slowly, slowly, we are raising the bar. And without your help and without your advocacy, none of the things that have happened thus far within this administration could have occurred. So I thank you. I thank you from the bottom of my heart for everything you do, everything you stand for. It means something. It means a lot. And so I just say thank you so much. Thank you for your time.